I am Kiya Movassaghi. I am a plastic surgeon and currently the president-elect of the Aesthetic Society, and I practice in Eugene, Oregon.
So the approach to facial aging or to reversing it has really changed a lot over the last 20 years as non-surgical technology and fillers and products and treatments and skincare have improved. And so it used to be that people would wait as long as they possibly could, have a facelift, and then they would come out of recovery and look a lot younger, like noticeably younger. How has your approach changed as non-surgical technology has come forward?
Very good question. It used to be you wait till you get old and then you come back and get something radical done. That's what we call rejuvenation. Now the paradigm has shifted to what we call pre-juvenation. How do you make, whether it's in your face, your skin, your joints, how do you make that healthy, youthful tissue last longer? That's that aspect of your lifespan that you want. That's the quality of life that we talk about, right? So with the pre-juvenation, there's a lot of technologies and products and injections and things that you can do to prolong that health of your skin, whatever, no matter which ethnic background you come from, because every ethnicity and every genetic background has its own aging process. But regardless of that, there are tools and medications and therapies and technologies that we can prolong that. So I'm seeing a big influx of patients in their 20s and 30s coming getting their Botox. My 24-year-old is like, Dad, I'm going to be in town next week and I want to get Botox. I'm like, come on in. We'll prevent, you got to get to 50 and you're not going to have wrinkles on your face. That's what we're talking about.
In your own practice, what kinds of non-surgical treatments do you offer to your patients?
I always tell my patients that, a good thing about a consultation with somebody like me who's a board-certified plastic surgeon and, has a lot of experience and, do a good job is the fact that I provide and offer the entire spectrum of aesthetic medicine and surgery. So at one end of the spectrum is skincare and lasers and technologies and injections and the Botox and the fillers and the fat injections. And then the other end of the spectrum is the surgeries and then different levels of the surgery, as we just talked about. And I customize that for the patient. But I tell them that, I'm not biased towards any of these modalities because I believe in them. That's why I offer them. But I also tell you the honest answer, the pros and cons of each. So if you come and show me you want an improvement of a level 3, but you say you want to get that with the fillers, I say you're wasting your money. On the other hand, if you come and say, I need a facelift, and I'm like, I don't see movement in your skin, I'll also talk you out of surgery. So I'm not biased towards any of these, but I'll try to make sure that I cater the care to you based on your needs. So it's very customized and individualized.
If we are listening today and we want to find out more about you or come see you for a consultation, where should we look for you online?
So you can go to my website, kiyamovassaghi.com. You can go to my Instagram, Dr. Kiya Movassaghi.
Thank you for your wisdom today.
Thank you very much for inviting me again.
Links to our guest's website and contact info are in your show notes. Follow us on Instagram at wherebeforemeetsafter. If you're a board-certified plastic surgeon and would like to be a guest or a sponsor of the show, go to wherebeforemeetsafter.com for more information. Where Before Meets After is a production of The Axis, the podcast agency for aesthetics. THEAXIS.io.